everyone. It's Marissa Lachlan from Joanne's Place here, and you're listening to the Wellness on Purpose podcast. There is no linear path along one's wellness journey, and it is very easy to get caught up in the latest health trends found on social media, which tend to redirect our wellness journeys. Things like, what's the difference between clean and dirty eating? How should I reduce my stress? How do I know if I'm regular? How much sleep should I be getting? What even is cortisol? And do I need to be taking a multivitamin? There is so much information being released in the wellness industry on and offline, and it can be very challenging to not jump on every bandwagon we read about. Here at the Wellness on Purpose podcast, our intention is to connect with experts in our community to inspire and educate you to take the next impactful and realistic step in your journey to live wellness on purpose now and for future generations. Hey guys, welcome back to the Wellness on Purpose podcast. This is our final episode of season 1, and I want to start by thanking you guys so much for following along, giving us reviews, liking, subscribing, sharing. We so appreciate you being part of our wellness community and supporting us along this journey. On this week's episode, we're talking to Dr. Brenda Tapp. Brenda Tapp is a naturopathic doctor who owns the Peterborough Center of Naturopathic Medicine in East City of Peterborough. The Peterborough Center of Naturopathic Medicine is an integrative cancer care facility that offers IV therapy as well as other modalities to support natural family medicine. This clinic strives to provide excellence in healthcare by providing you with the most effective natural therapies validated by clinical research and traditional use. This clinic also believes that naturopathic medicine and conventional medicine work very well together. Stay here, listen to the rest of this episode with Dr. Brenda Tapp to learn more about her clinic, their offerings, and how she reduces her stress to increase her energy. Welcome, Dr. Brenda Tapp. How are you today? Thanks for joining us.
I'm good. Thank you so much for having me.
Yeah, I'm excited for this episode. All right, so we'll just jump right in. Just share with us a little bit about you, who you are, what your practice is, and maybe a little bit about your niche to start.
Sure, yeah. So, my name is Brenda Tapp. I've lived in Peterborough for most of my life. Elementary school, high school. I went to Trent University, so Peterborough is in my blood, and I love it here. I own a practice, a naturopathic practice in East City called Peterborough Center of Naturopathic Medicine. And that practice is my baby, and I've built it over the last 6 years. So this year we're celebrating our 6th birthday.
That's amazing.
Yeah.
So you weren't always in East City, where you were... I can't remember exactly where your clinic was before.
So when I first started practicing, I was working with another naturopath here in town.
Okay.
Dr. Uea Erdman.
Okay.
And then after a year of working with her, I opened my own practice, and I opened it on Charlotte Street.
Right, okay.
And within, I'm going to say, 2 years of working there, maybe a year and a half of working on Charlotte Street, we outgrew our space pretty quickly.
Yep.
And there was a building for sale in East City that I absolutely loved.
It's so nice. It's a beautiful space.
Yeah. East City is my favorite part of Peterborough.
Yeah, it's so nice and quiet, and everyone can get to it, I find easily, so that's awesome.
Yeah, so Ashburnham Realty bought the building,
yeah.
And they've been a great landlord.
Awesome.
They're very much supportive of small businesses, and I've been able to grow my practice out of that space there.
That's amazing.
Yeah.
So who else, what other practitioners are in that space with you?
Yeah, so I've got myself, I have a nurse practitioner, I've got 2 IV techs, I have a food sensitivity coach, I've got someone who does Reiki, reflexology, and live blood cell analysis.
Wow.
I have a massage therapist and 2 reception staff.
That's amazing.
Yeah.
And you guys are Monday to Friday operation, and you can book in, you guys do the online booking, or how do you guys do your booking system?
Yeah, we don't have online booking. You call or email the clinic, and we get you booked in with whichever practitioner you want to see.
That's amazing.
Yeah.
So maybe let's talk about what kind of services as a naturopathic doctor that you offer that is maybe not necessarily different than other naturopathic doctors, but that's a little bit more unique for you.
Yeah. My passion in my practice is integrative cancer care. So I see patients with all sorts of health concerns, from digestive issues to hormonal issues to chronic infections to arthritis. But my real passion is definitely with integrative cancer care.
Did you always know that, as you were going through school to be a naturopathic doctor, or
No.
did this kind of come? Okay.
Yeah, no, not at all. When I was in school, my goal was to be a doula and work with midwives and do perinatal health. That's what I pictured my practice turning into. So it's changed completely.
Did something happen for you to switch to this? Did you just see that there was a need for this, or?
I would say there was for sure.
Yeah.
When I was in school, one of my aunts got really sick with breast cancer and actually passed away from breast cancer. I had another aunt be diagnosed with breast cancer. She's still with us. And then I myself ended up developing precancerous cells. And so I guess through all of those events in my life, my practice kind of transitioned just for personal reasons, wanting to, reduce my risk of cancer, with breast cancer prevalence being so high, and it being on both sides of my family. I wanted to do everything I could to reduce my risk there.
Wow.
Yeah.
And would you say that you have one common cancer that you see a lot of in your practice, or?
No, not really. I guess I see more breast and prostate cancer. I see quite a bit of ovarian cancer, but I also get very rare cancers as well. Cancers that even medical oncologists don't see often, and they're kind of stumped with how to treat. So I do see quite a range.
Quite a range, yeah.
Mm-hmm. Mm-hmm. Yeah.
Like when a patient is coming to you, do you find that it's more common for them to seek out a holistic approach before seeing a doctor, or do you feel that's the other way around, or a bit of both?
With respect to my cancer patients, or everyone in general?
In your cancer patients, right?
Okay. So all of my cancer patients have seen an oncologist first.
Yeah.
I think it's really important to say, what I do does not replace conventional care. I don't replace chemotherapy. I don't replace surgery or radiation or anything like that. And my recommendation is always to go with conventional care.
Yep.
But what I do, naturopathic medicine and integrative oncology, is a great way to, reduce side effects of chemotherapy, to reduce side effects of radiation, to make those treatments more effective, to reduce recurrence of cancer in the future once you've gone through all of your conventional care treatments. That's what I do. So all of my patients have seen an oncologist first.
Okay.
Yeah.
And would you say that you have some patients that are coming to you just for preventative measures as well? Like cancer does run in the family and they want to just be aware of what could happen?
Yeah, absolutely. Whether it be primary prevention in that they've never gotten cancer before, but maybe they have the BRCA gene runs in their family, so they're at greater risk of breast, ovarian, or prostate cancer. So I definitely see that. And then I also see people who have gone through all of their treatments, and they're looking to reduce their risk of recurrence. Certain cancers are likely to recur more often than other cancers, and they don't want it coming back. So I'll see patients like that as well.
Yeah.
Yeah.
It's probably different for each patient you see, but is there, if you were treating somebody who was going through chemotherapy, how often would you see a patient for additional support, whether that be nutrients or IV therapy? Is it, I'm sure it's different every time, but is there maybe every month that you would see a patient, or?
Yeah, it is different every time, but typically I like to see someone prior to them going through their chemo.
Yeah.
So we can make sure nothing they're taking supplement-wise is interfering with their chemo. I'll see them before they go through their radiation or before they go through their surgery, and then I'll see them after their treatments as well. Mm-hmm. But if someone chooses to do a more intensive treatment protocol that involves something like injections or IV therapy, then I'll see them quite often to make sure that they're tolerating it well.
Yeah.
Yeah.
Would you say that there is a lot of supplements and drugs that do interact with doing a chemotherapy treatment?
Yeah, absolutely. Yeah.
And I feel like just being at Joanne's when you get a customer that is going through chemotherapy, sometimes they're just advised to stop taking absolutely everything. And I feel on a holistic standpoint, sometimes that can be more detrimental for the long-term stress of it as well, too. Do you see that with some patients?
Yeah, absolutely. So when it comes to working with oncologists, I try to make sure all of my supplement recommendations have evidence in the medical literature to support their use with their chemo or with their radiation. That way I can give an oncologist the list of research that's been done to show this is why we're doing what we're doing, and here's evidence to support safety of using it during their chemo and radiation. But for example, things like antioxidants are dangerous to use during chemotherapy because it reduces efficacy or effectiveness of the chemotherapy and radiation. There are studies that show that it improves quality of life during chemo or radiation, but maybe doesn't lengthen life, which is most important. So once someone is through their treatments, then bringing antioxidants into their treatment protocol is something that I do, absolutely, but during chemo and radiation I'm very careful with it. I also talk to patients about half-lives of their chemotherapy. So all medication has a half-life, so that's the amount of time it's in your body until 50% of it is eliminated. And then you also have to be careful of supplements that detoxify the body during chemotherapy. Lots of people come to me saying they want to be on a detox, but if you are on a detox and kind of improving liver function, you're theoretically eliminating a chemo much faster than what it would be eliminated if you weren't detoxing. So I'm always cautious of that with my patients when they come in to see me.
Good. And do you feel like not just oncologists, but doctors, conventional doctors and general medical doctors, they are resistant to naturopathic medicine during treatments, or do you find that they're starting to realize that the general population is looking for other alternatives?
Yeah, I've been practicing for 7 years now, and over those 7 years I've seen a slow shift of physicians becoming more open to naturopathic doctors. I do think there are a lot of stereotypes that are out there that maybe prevent the two types of medicines from working together, kind of synonymously or seamlessly for the benefit of our patients. One of those stereotypes or one of those myths, I guess, would be that there is no research out there to support what we do. And the research is out there on some things. In the world of integrative oncology, there are certain supplements that are researched relatively well. Melatonin, curcumin, green tea extract, Coriolis versicolor, also known as turkey tail, mistletoe extract, like mistletoe. There are certain things that are researched more than others for sure, but we don't have those big studies that pharmaceutical companies are able to find. We don't have those,
And that's what it comes down to, is the financial piece of huge pharmaceutical companies that can do anything, right? Do any research that they want to.
Yeah, that's part of it for sure. But I think another part of it is also ethics. Like, for example, if you're dealing with a group of people who have cancer, we have to make sure of safety of a supplement before we start studying it with those patients as well, and safety in conjunction with chemotherapy. And so if we don't have those pre-studies, it's difficult to get those clinical studies. But some of those supplements that I've mentioned earlier, we have those studies on. They're just not as large of studies as maybe oncologists are looking for.
Would you say that there's any other major myths in the naturopathic medicine or in cancer treatment as well?
Yeah, one that I hear often is that what I do doesn't work. And this is kind of on a different topic than there is no research, but I think we have to maybe define what the term work means. If what you're using as its definition is curing a cancer, yes, you're right. What I do does not cure a cancer. But if you change the definition to does it improve success of chemo? Does it improve quality of life? Does it reduce pain? Does it reduce inflammation? Does it improve sleep in cancer patients?
Yes.
And yes, what I do works, absolutely. And there are studies that use those endpoints and confirm those endpoints when it involves using supplements with chemotherapy.
I love that change of perspective on it. And I think that working is a different definition depending on what aspect you're looking at the treatment of, right?
Yeah, absolutely.
That's really good. So one of the modalities that you offer in your clinic is IV therapy. Can you talk a little bit more about this? Because it's becoming more available to a lot of people who are going through a little bit more of an extensive health concern.
Yeah. IV therapy is using vitamins intravenously instead of taking them orally.
Okay.
And there are many reasons why you would want to do that.
Mm-hmm.
One is that a lot of cancer patients maybe don't have an appetite and they struggle getting food into them because it doesn't taste the same. Their taste buds have changed. They just don't have an appetite. And then they have increased pain, they have fatigue, they have all of these symptoms that come along with not consuming nutrients orally. So if we can, bypass that, after we've had the conversation of what foods are good to eat, what foods are very nourishing, after we've talked about soups and broths and smoothies and that kind of thing, then maybe patients will consider IVs of vitamins. Now, those vitamins will vary depending on what other treatments someone is undergoing. Low doses of vitamin C are an antioxidant, so we don't do those during chemotherapy or radiation.
Mm-hmm.
High doses of vitamin C are no longer considered an antioxidant. They're considered pro-oxidant, so they create oxidation in the body.
Mm-hmm.
And high doses of vitamin C are being studied intravenously in conjunction with chemotherapy. And we do have safety studies, and we also have studies that show improved quality of life, which is really important.
That's amazing.
Yeah.
So how long would an IV session take? Does it depend on how many vitamins are in there, or what is that like for a patient?
Yeah, it depends on a lot of things. So it depends on the size of the IV bag. It depends on whether or not we're trying to hydrate a patient. If we are, their IV bag is generally a lot larger.
Yep.
It depends on the number of vitamins and the quantity of vitamins in their IV bag as well. So a high dose of vitamin C usually takes over 2 hours to drip. Because it's a very concentrated IV bag,
Mm-hmm.
and if you drip it too quickly, you'll develop side effects. You'll get a headache.
Okay. Yep.
Yeah, it may impact your electrolytes.
Yep.
There are definitely side effects that can come when you drip an IV bag too quickly, and then you also have to look at tolerability of the IV.
Yeah.
Too. Some people's veins are more sensitive than other people's veins, and so they have to be dripped slower.
Yes. Yeah.
Mm-hmm.
Do you see a lot of kids as patients?
Yes, not when it comes to pediatric cancers.
Okay.
Yeah.
Yep.
Mm-hmm.
I just think when I'm thinking a bag size, I'm like, oh, does it depend on age? How small would it be for a child? How big would it be for a full-size adult? But again, it would just depend on what the purpose of the IV drip would be for.
Yeah.
Yeah.
Mm-hmm.
That's awesome. So being a naturopathic doctor and having a holistic lifestyle, what would you say some things you do day in and day out to support your wellness journey? What does that kind of look like for you?
Yeah. I guess I'm always finding new ways to do that, but over the last 7 years, what's been most effective for me and most important to me is getting outside, spending time outside and taking time to recharge. I am very much a type A person. I am go and a big nerd. So I like to read and research and learn everything I can about a topic, and that can be very draining and exhausting.
Yes.
I want to help as many people as I can, and spread the word on integrative oncology. But that takes a lot of mental power and a lot of time, and doesn't leave a lot of time for myself. So I've found over the 7 years that I've been practicing that my work-life balance hasn't always been the best. I'm definitely the first person to get caught up in the like hamster wheel of life of, of working long hours. But the best thing for me is getting outside.
So like walking, like what are your favorite things to do outside?
Yeah, being surrounded by nature is the most important thing. So I have a kayak, so I like getting out on the water and kayaking. I have a motorcycle, so I like taking my bike on like the back country roads, not busy highways. I love hiking, so we're so lucky that we've got so many parks around here that we can hike in.
Yeah, it's true.
I think we always forget about the importance of mental health and taking time for ourselves.
Absolutely.
I think a lot of us, myself included, get caught up in getting the perfect Instagram picture, and we forget to take care of our mental health.
Yeah.
And I know when I don't spend time outside, I get really anxious, and being outside in nature helps with that. So it's something that I really promote to my patients, absolutely. It's mental health is one of the last things that we
tend to address. It tends to be the last thing, of course.
Yeah, exactly. But we now have studies, and I always take it back to the studies. We now have studies that show being outside in nature reduces things like your inflammatory markers and reduces your cortisol in your blood, and it increases your natural killer white blood cells. And like we have these studies that show us how good it is for us, and we forget to do it.
Yeah.
Right?
It's true.
So I always try to remind myself that it's important to slow down and stop, and even if that means sitting outside over by the river at the baseball diamonds in East City for 5 minutes on a lunch break.
That's something. Absolutely.
Yeah. So for me, that's what's most important for my health and wellness.
Yeah. And I think too, running a business and helping other people, it's really, like I talk about this a lot, you want to find your work-life balance, but sometimes it's just not possible. And I think that as practitioners, it's and any entrepreneur really, it's okay to be like, it's not possible right now, but what can I do during this time to support me additionally so that I stay on my A game, so that I stay healthy, I'm not getting sick, I can bring my anxiety down, because sometimes that work-life balance just doesn't happen.
Yeah, exactly.
Yeah.
And it's not about like an all or nothing approach when it comes to your health, whether it be as an entrepreneur or someone who's been diagnosed with cancer. It's just about taking that first step.
Yeah.
Like one step is better than no steps, right?
Yeah.
As long as you're moving in that direction towards health, choosing the healthier alternative of which bag of chip you're going to eat because you are, craving comfort food.
Yep.
Choosing something healthier than what you would get at a convenience store, or maybe that's 2 minutes outside sipping your morning coffee instead of a half an hour walk. Maybe that's, it's always about choosing the healthier alternative. We can't be perfect.
No, we can't. And you can't be perfect, because I'm sure you've seen this in practice. I know I personally have gone through this as well too, is that perfectionism can be the controlling factor over an unhealthy relationship with your entire lifestyle, whether that be food, whether that be relationships, emotions, whatever it might be. Having that picture perfect of it has to be this way, it can be so damaging to your entire lifestyle, right?
Yeah, and even with my cancer patients as well, a lot of them want to have the perfect diet, and take all of their supplements quite regularly, and it's all about like perfectionism, but that brings a lot of stress for people. So I try to talk to people about just, getting a little bit of healthy food into their diet if doing it 100% is impossible for them.
Yeah.
That perfectionism creates a lot of stress.
Yeah. And stress is really the leading cause of every disease, right? Yeah. It's a big player. So with you and your personal wellness journey, so getting outside, is there any other things that you feel that are really important to have in your routine?
Yeah. So not only do I try to get outside, I also try to, change my lifestyle so I can reduce exposure to certain chemicals in my life. So I don't eat out of plastic containers. I don't use scented personal care products. I try to live a very clean life that way. One of my favorite products from Joann's that lets me accomplish this is my Diva Cup. I've been using one for maybe 10 years, and I absolutely love it.
It's a game changer, for sure.
Totally. Not only does it reduce my exposure to things like dioxins, which are not good for our health and increased risk of things like endometriosis and pelvic inflammatory disorder or disease, it is also good for our environment. So it reduces waste in our environment, and the health of our environment translates to our health as well, right? Our food,
Absolutely.
The food that grows in our soils, the air that we breathe, all of that is very important for our health. So if you can improve the health of your environment, you also improve your overall health.
Absolutely. Yeah, for sure. Yeah, I always say that to people. They get so nervous about the Diva Cup. I'm like, no, you just have to do it and try it. Like, first of all, it is a game changer, but there's just such a great impact on, like you said, reducing the waste, but also the chemical exposure that I think a lot of people don't even think about when they're using conventional tampons and pads.
Yeah.
Right?
Yeah. I mean, this is probably a topic for a whole nother podcast, but the skin, the tissue in that area is so, its ability to absorb chemicals is so much higher than just your skin in general. So you want to make sure that you don't expose that area to any kind of chemicals if possible.
Absolutely.
Yeah.
If you were stuck in an elevator with somebody or anywhere and you just had the opportunity to have a real conversation with them on a naturopathic doctor perspective, what would be one piece of advice that you could give to that person and all the listeners that can really just inspire them a little bit more on their wellness journey?
I think that piece of advice would be to find something that gives you joy.
Yeah.
Like true, real, like that fire deep down inside of you kind of joy, and hold on to that.
Yeah.
Make it a big part of your life. Somehow sneak it into your daily routine and really hold it close to you. And if you can feel that joy, that like true joy, then wellness will come easily. You'll be more likely to take your supplements and eat healthy and want to get outside, but finding that joy is really important.
That's amazing. That's so good. It's so funny, like, so many people say that, you know, find something that you can hold on to, and it's like, well, it could be a relationship, it could be an item, it could be a thought, it could be a goal, it could be whatever it is, but whatever it is, you have that drive to continue to keep working towards it, or continue to remind yourself, like, this is why I'm doing this is why my health matters, is because I have something to look forward to, or to reach. So that's amazing. I love that.
Yeah.
Perfect. Well, thank you so much for joining us today. It was such a great insight on learning a little bit more about your practice. I know it's a very unique practice, and I feel that there's such a place in conventional medicine for the support of a naturopathic doctor through cancer treatments, and just a naturopathic doctor in general as well too for any health concerns. So thank you for being on the Wellness on Purpose podcast today, and I hope you enjoyed yourself.
Yeah, thank you for having me.
Yeah.
Thanks again for joining us today, Brenda. I will tag her social media handles as well as her website in the show notes, so you can contact her there. As I mentioned at the beginning of this episode, this is the final episode of season 1 of the Wellness on Purpose podcast, and we really can't thank you guys enough for following along on this part of our journey. We love serving you guys as the experts of health and wellness in our community, and we cannot wait to bring you season 2. So stay tuned on our social media platforms to see when the launch of our first episode will be. As always, we hope that you're inspired to live wellness on purpose now and for future generations.